Hey everybody, it's Dr. Lynn. I just kind of want to check in. I know we haven't done this in about a month or so. Hope everyone is doing well, and I want to say thank you so much for following. In the last month, we've gained 15 new patients, so Facebook is definitely reaching everybody, Instagram Live is definitely reaching everybody, and of course our other outlets, which include YouTube and Twitter. Thank you so much for liking, commenting, and subscribing to all of those social media outlets. Today, I just wanted to give you some updates as to what's been going on in the medical marijuana industry. I had an awesome trip to California last week, and to see the difference between recreational marijuana use and medical marijuana use was vast. Totally encouraging and definitely educational. Had an amazing time out there, but it's definitely a different perspective. As you know, when I speak, I'm only licensed to prescribe in Florida. That's where I live, that's where I work, that's a state that I'm passionate about, so all of my facts and all of my information is Florida-based only. My perspective and my knowledge are applicable to Florida residents only, okay? As you know, medical marijuana is definitely regulated state by state. So of all of our states, 29 of them have legalized medical marijuana, in Washington, D.C. as well. It's organized by the Department of Health. So if you're concerned that your state is up for debate, is there a possibility that medical marijuana or recreational marijuana might become legalized in your area, check with the Department of Health for your state. They are the organization that kind of head that division, and they'll let you know the latest updates if it's even a topic of debate for this season, for the new political candidates, let you know that the state is considering it, if it's possible for you to get involved on the political respect and write petitions or gather some more information, attend your hearings. All of those things are important to mobilize getting medical marijuana approved by your state, okay? Let's see. I wanted to go over today a couple of questions that I've been getting in my inbox, and I figured the best way to disseminate all this information is to do a quick live preview and give it to everybody straight, so that way I'm not typing several emails back. Hopefully this is sufficient, and if you need some more information, please feel free to DM me or to email me directly at info@askdrlyn.com, okay? One of the most frequent questions I get is who can use medical marijuana? And the question is anyone. There is no addictive properties to medical marijuana. It is safe. There has never been a documented overdose case of medical marijuana. So it is legalized for everyone to use. Understand, there's terms and conditions that go with that. So if you're less than 18 years old in the state of Florida, you have to have 2 doctors approve your use. Medical marijuana is not a first-line treatment, okay? It is for specific conditions in the state of Florida, and you have to be able to show that you've tried alternative options for your treatment, especially for pain relief, before I'm able to approve you for medical marijuana. And that does not necessarily have to be prescription. It doesn't have to be narcotics, it doesn't have to be opiates, but you have to be able to say, I've tried meditation, I've tried therapy for my anxiety, I've tried other methods, and they haven't been satisfying. So in order for me to kind of get you to the point that we can say medical marijuana is a good option for you, you have to prove to me that you've gone through all of those other channels and you've given them a chance for traditional methods and they haven't been sufficient, and now you're at the state where you're interested in trying or using medical marijuana. You can use it anywhere from infancy until 80, 90 years old. One of my oldest patients is actually 89, and my youngest patient is 20. Me personally, I don't prescribe for children. Pediatrics is not my specialty. I'm an emergency medicine licensed physician, and I try to stick within my field, do what I know, what I'm confident in. Pediatrics is not something that I choose to prescribe to. Can I? Yes, but it's not my preference. If you have any question about getting pediatrics, getting a physician who specifically likes to prescribe medical marijuana for pediatrics, please hit me up. I'll refer you in the right direction. I'll get you to the person that you need to talk to. But me, myself, I'm not going to prescribe for anybody less than 18 years old, okay? Hopefully that clears some things up for a lot of people. I've had a couple of families reach out to me for their children who have seizures and epilepsy, and they are definitely candidates, but I will not do it for them. But I will gladly help you get to you where you need to be, okay? In the state of Florida, there are only certain medical conditions that are approved for medical marijuana at this time. Granted, these things are evaluated on a regular basis. There's an entire committee that goes through and decides which conditions are approved. They don't just pick them out of thin air. They don't just come up and say, hey, let's go ahead and include HIV on the list for an approval case. No. There have been medical trials and studies, and those studies have determined that medical marijuana is a good choice for treatment based off of the studies that have been done, okay? At this time, the approved conditions include cancer, epilepsy, which we talked about are seizures, glaucoma, which is pressure in the eye that's elevated. So that was actually one of the first conditions and the most popular conditions that marijuana was approved for. HIV and AIDS, post-traumatic stress disorder as well. Remember, it was just Veterans Weekend over the past weekend where we honored many of our veterans who have seen so much and done so much for us. Many of them suffer from PSTD, post-traumatic stress disorder. And just to let you know, you do qualify for medical marijuana use. Know that it's not paid by the Veterans Hospital. Know that it cannot be paid by your Medicare or Medicaid. This is an actual product that you will not be able to use your insurance to qualify for. It is a business that this time that is cash only. So when you go to the dispensaries to fill the recommendation that I prescribe for you, you will not be able to submit your prescription card and get a discount or anything like that. It's strictly a cash-based industry, and as of this time, it is not approved by the FDA, and therefore the pharmaceutical companies are not licensing it. It's licensed by distributors, okay? Let me tell you the rest of the list of the approved conditions though. ALS and Lou Gehrig's disease, Crohn's disease. If you don't know, Crohn's disease is a large intestine disease which has a high risk of developing cancer later in life. It has a lot of complications with your diet and the way you process, and it causes significant amount of pain and discomfort. So Crohn's disease is also approved, Parkinson's disease, and multiple sclerosis. Remember, within that list of medical conditions, as your provider, I have a lot of room. It's called a gray zone, where I'm able to discern, are there any other similar conditions that qualify? For example, anxiety is not specifically on this list, but I have a good number of patients that qualify because anxiety falls under the category of post-traumatic stress disorder. I had a patient the other day that has Tourette's. Tourette's is not exactly on this list, but it is a seizure condition, and it can qualify under the category of epilepsy and seizures. So please, if you don't see your specific ailment on the list on my website at askdrlyn.com, feel free to email me, feel free to DM me, and just say, hey, do I even qualify? You can text message me or call me. I'm always available to my patients. You saw my hours posted from 10 a.m. to 10 p.m. If I don't get back to you immediately, I'll have one of my assistants respond to you, but just know that within 24 hours, you'll have a direct response from one of us, okay? The final condition would be any terminal condition. Terminal conditions, just to clarify, are diagnosed by a physician that states that the patient has less than 1 year to live. And whatever condition that is, whether you have a terminal cancer condition, a terminal brain injury condition, if it's terminal and the patient has less than 1 year to live, they actually have the right in the state of Florida to try medical marijuana without anyone's approval, okay? So, again, to refer to my website if you have any concerns that could your ailment qualify for medical marijuana. The last one is chronic malignant pain. Now, that is a category that leaves a lot of room for discussion. For example, I had a patient call me last week and say, Dr. Lynn, I just got in this car accident 2 weeks ago. I want to try medical marijuana. I do not want to do the Motrin they're prescribing or the Flexeril or the Percocet pills. I want to do medical marijuana, right? And I said, thank you for considering me. But your condition of your back pain that just occurred last week or 2 weeks ago doesn't qualify because it's not considered a chronic malignant pain condition. Anything that is considered chronic is greater than 6 months, okay? So this young lady got in her car accident 2 weeks ago. So she does not have a chronic pain condition at this time. If she continues to have this same pain beyond 6 months, she's gotten CAT scans and MRIs to decipher what the source of the pain is. And at that point, she says, I've tried other therapies, I've tried cortisone shots, I've tried, yoga, all of those things, and none of them are providing the relief that I'm hoping for. Then at that time, we can discuss medical marijuana once she's had the condition for 6 months. But I will not prescribe for patients who have conditions of pain or concerning for pain that is diagnosed less than 6 months ago, okay? I hope that helps, and I hope it doesn't turn too many people away, but I gotta be honest with you, and most importantly, I have to protect my license, because at the end of the day, what I'm doing is very new. It has only been approved for a little over a year in the state of Florida, and we have to protect the integrity of it. Medical marijuana is not anything that we want to be taken for granted. It is not anything that we want to be taken out of context, and nor do we want to lose the approval in the state of Florida. Okay, so everything that I'm doing is according to the rules and the legislation that is written by the state. And of course, like you have somebody to answer to, I have somebody to answer to as well. So not only am I submitting your prescriptions to the dispensaries where you can fill them, but there's actually a pharmaceutical board that oversees the prescriptions that we write, and we have to make sure that your condition is legit and it qualifies for receiving medical marijuana. So it's not to be hard on you, or it's not to turn you off, but it's to be honest with you. And I always do that with my patients in terms of letting them know this is a good option for you, I think you should try it, or maybe not at this time. Okay? Another question that I got is, where do we fill the prescriptions? As you can see, if you're riding down any one of these streets, there's several smoke shops that are popping up. And these smoke shops, they now are starting to carry CBD oil and TCH oil. Okay, that's great for them. They also carry some edibles. They are not approved dispensaries. There is an actual list of approved dispensaries in the state of Florida, and those dispensaries are approved because they receive their product directly from the grower. Most of the growers are in northern Florida, and they grow the medical marijuana under lights, is what they call it, or in a greenhouse where there's no potential for contamination. They take the actual marijuana plant and bud that they grow, and they go through a filtration process where they actually extract the oil and the cannabinoid and the CBD component. That is the medicinal part of medical marijuana. So getting medical marijuana, it does not mean smoking trees. You can see a lot of advertising, especially in states that have it as recreational as well, where you'll see people smoking. Smoking is not one of the methods to qualify for treatment for medical marijuana. What is approved right now is vaping, and that's where you take the concentrated oil, you put it in a vape device, and you inhale and exhale through that method. Another approved method are creams. You can do tinctures or elixirs where you do drops under the tongue or on top of the tongue, and you can also do pills, okay? Just so you know the difference, that you might go to some states where you see people smoking, and down here in the state of Florida, actually smoking marijuana is not approved for medical marijuana treatment and dispense, okay? Again, where can patients fill the prescriptions? There are a list of dispensaries that is available through the Department of Health that are approved locations. When you get approved by me, what I do is I submit your recommendation to the Medical Marijuana Registry. That registry is accessible by all the approved dispensaries, and you can only fill your prescription at one of these approved dispensaries. I don't actually give you a prescription piece of paper with a recommendation on it. So this is all done electronically in order to protect the security of it. You can't take that prescription paper and just run it up the street to Walgreens or take it to any smoke shop and try to get your prescription filled that way. It won't work like that. You have to make sure you're going to an approved dispensary, and I can help you find that. One thing that I try to do with my patients is make this process as seamless as possible. Many of them will attest to you. I walk you through step by step from day one of getting you approved, getting your application approved, actually receiving your card, and getting to the dispensary. I've taken the time over the last 6 months to form relationships at all the dispensaries, especially in the Broward and Dade County, because that's exactly where I live. So I have relationships there, and they welcome patients. They welcome them and they educate them. What I prescribe to you is a generic prescription, and I work with you to tailor that to approve you for the minimal amount of marijuana that you would need to achieve the highest possible relief. So my goal is not to overdose you, and it's not to underdose you. But just like any recommendation or prescription, you have to be able to give yourself some leave room, because we have to be able to experiment and see, is this the right dosage for you? What I like to do for safety is start off low, and then we build up to achieve maximum relief with the minimum amount of marijuana. I see we have a question that just popped up on our IG Live. It says, my wife has been diagnosed with Crohn's for 15 years, and she's on Humira. She was also diagnosed with anxiety and panic disorder. Would she benefit from medical marijuana? Absolutely. She has a qualifying condition, which is anxiety and also Crohn's. Humira is an awesome treatment that has been ongoing for years. Whether that's providing the relief, I'm not sure how often her flare-ups are right now, but usually medical marijuana can definitely help to calm down some of the pain from Crohn's disease and also relax some of the anxiety from the condition. We can definitely talk more offline. Feel free to reach out to me. Thank you so much for the questions. As you guys see, hey, Mike says, hi, Safiya, this is awesome. Thank you so much for joining. My awesome colleague, Dr. Stryker, and he also recommended his family member to me. Let's go on with a couple more questions, because I want to get you as much information as possible in our short amount of time. Another thing about prescriptions are I usually write them for a total of 30 days. Approved by the state is a prescription for 70 days for marijuana. We can do that if we need to, but the reason why I do it for 30 days is because I like to give us room to adjust. I don't want to just put some medicine in your pocket and say, hey, try this and let me know how it works. No, I want to make sure that I'm working with you to achieve, the maximum relief, and that you're not overpaying. So if that particular strain or that type doesn't work for you, or that concentration doesn't work for you, I don't want you buying an excessive amount of the product, because this is not CVS. You cannot bring the medical marijuana back to the dispensary and say, hey, this doesn't work for me, can I switch it out? It doesn't work like that, okay? So just know that I'm not trying to be stingy with the medicine, but there's a method as to why I only do 30-day prescriptions, because I want to make sure that we have the right medication for you. I want to make sure that it is the best concentration for you and your body is reacting well to it. As I said before, there are very few side effects of it, but there are side effects. It is medical and it is marijuana, so we want to be honest in terms of how we feel and how we're responding to the medication. Side effects also come into play when you're doing other medication in addition to the medical marijuana. So many people are not just taking medical marijuana. They're actually on blood pressure medications or diabetes medications. And granted, medical marijuana doesn't interfere, but anything that's put into your body has a potential for interaction. Dr. Stryker said, can you talk a little about the different strains that are available and their use in different conditions? I am going to go through that. We're going to talk about indica and sativa. The next question, let's go right into indica and sativa, since we had a specific question about that from Dr. Stryker. So indica, there are two popular strains, indica and sativa, and you'll see hybrids of the two strains. When I do the prescription for you, I prescribe for low TCH, right? Both of those are low TCH marijuana. When you go to the dispensary to fill your prescription that I've done for you, you talk to the educators there. You talk to the bud tenders, is what they call themselves. Like bartenders, but they're bud tenders. Very cute. You talk to them, you tell them what you're trying to achieve, you tell them what your goal is, and they help guide you in terms of what is the next best thing for you to try. Is a blend of the two strains a better option for you? Is it possible for you to do an individual strain and try it and see if you like it and then possibly blend the two? So they talk to you about that process, what the likely reaction is that you'll have, and how it'll make you feel. Indica specifically provides a general sense of deep relaxation. It also stimulates your appetite. It causes you to have pain relief. It helps you to sleep, and it causes a natural, more stress reliever, and your attitude is more calm and carefree. The other popular one is sativa. That's an energizer and stimulant. It causes you a cerebral high, is how they describe it, because it gives your energy level a boost and it makes you feel more ready to go. It helps to focus you, which can release a better creativity, and it helps you to fight depression, and it's really good for patients who are going through anxiety, depression, and they need something to help make them more cheerful and more alert and more energized. The bud tenders will discuss all of those things with you. A couple other questions that I wanted to go through. When you get an actual medical marijuana card, and you can just Google medical marijuana Florida card, you'll see what it looks like. It looks similar to a driver's license. It has your picture on there. It also has a patient ID number, which is assigned by the Florida Department of Health. It has a card ID number, a date of birth, your address, and it has an expiration date. The Department of Health likes to do cards for annual renewal, okay? So just so you know that you get the card, but you have to continue to update it. And the reason why they do that is you have to make sure that you're seeing your physician who is prescribing for you, which would be me. We would schedule regular visits throughout the year so we can reevaluate and make sure that this is the right medication for you. And they also want to make sure that your condition and your ailment hasn't changed. For some people, they can continue to use medical marijuana and have no problem for several years. But for others, if their condition has improved, for example, if it was for back pain and the back pain, you decided to have surgery and you don't have back pain anymore, or for whatever it is, they want to make sure that if that ailment is gone and you don't need the marijuana, then we can actually come off of that. The goal in life is to be as natural as possible, of course, and to make sure that you are using as minimal medicine as possible, including medical marijuana. But if you do need it, we want to make sure we're getting it to the right people. We have another question from Rosario. Is this covered by health insurance or cash only? It is cash only. No health insurance can approve or help to offset the cost of medical marijuana, nor are they involved in the actual treatment with the physician as well. Just a heads up for my initial visit. The initial visit includes our meeting each other. We go through our history and our physical. We enter all of our information. I do a physical exam. That's $149. And for follow-up visits for refills, it's $99. You'll see all different variety of costs, and we'll go through some of that as well. What forms and dosage amounts of medical marijuana are allowed? We talked about vapes and creams and tinctures and pills. There's also edibles. Know that when I prescribe medical marijuana, some people get a prescription for maybe 5 milligrams per day. Some people get a prescription for 80 milligrams a day. What helps me to decide what you need is your smoking history. Have you ever used marijuana before? Your body weight and size, and also your condition. For people who have a higher tolerance and have used certain narcotics or medications or marijuana in the past, then they are able to use a higher dosage. For those who take one Tylenol every day for their pain and want to try medical marijuana so that they can get off the Tylenol, I'm not going to start you at a prescription of 80 milligrams a day. Know that this is exactly like any other medication that I'm prescribing. I always have to consider the patient's lifestyle, the patient's safety, the patient's size and weight, and what they can tolerate. I don't just pull these prescriptions out of thin air. It's not a universal prescription that everyone gets. It's customized to the patient and to their specific condition as to what's going on. We talked about dispensaries. Let me tell you a list of the ones that are approved in the state of Florida. They would be, it's called CTH Medical, Green Solutions, True Leaf, which we have awesome friends down in True Leaf, Miami. Satira Therapeutics, Modern Health Concepts. There's actually a location over there in Aventura, which is really dope. Knox Medical and Grow Healthy. They have several locations. If you do not live next to one of the dispensaries, know that they have delivery methods, and the majority of their clients and patients use the delivery system. They may go to the dispensary for the first or second visit to help customize exactly what they need, but after that, they have a delivery system that has a flat rate for most of them, usually anywhere from $25 to $40, and they deliver the medication to you whether it's a weekly or a monthly basis or however you decide to fill it. Renee Carter asked, what is the normal prescription? Normal prescription, we just talked about that a little bit a few minutes ago, but just to let you know, it ranges from 2 milligrams to 100 milligrams per day. And averaging for what I've seen so far, I'm prescribing maybe 20 milligrams every couple of hours, which will total almost 80 milligrams per day. That also, please keep in mind that I only prescribe for adults. I'm prescribing for people that have chronic conditions, and a lot of my patients have used marijuana before. So that's for me. And as I said before, it's customized per patient. That's not something that's universal. It's not just a written universal amount that everybody gets. We talk about what's important for you, and we talk about what you need to achieve your relief. Renee, we can go offline and discuss a little bit more if you need some more information about that. Are the prices for medical marijuana the same everywhere? No, they're not. After doing some research in the state of Florida, I wanted to price my specific cost, the $149 for the first visit and the $99 for refills, at a very affordable and fair price. It was important to me that patients were able to get in to see me, so the accessibility of myself, and then also afford the product. A lot of this is cash only. So I understand and I'm considerate of everybody's personal expenses and their daily lifestyle, and I just want you to know that I'm definitely willing to work with you. We can negotiate, but we also have to be mindful that if you decide to start medical marijuana, it's an investment and they only accept cash at the dispensaries, okay? Some of them will do a credit card if they're with a specific company, but check with the dispensary. Majority of them only do cash. Physician costs range from about $99 to $250 when I was doing research in the state of Florida. Again, my cost is $149 for initial and $99 for refills. And remember, don't forget the cost of the actual application, which is determined by the state of Florida, is $75. Once you get the application emailed to you from the state of Florida, you have to mail them a check. I know, super old school, but they only accept checks. They are not on an electronic system yet. It requires you to mail them a check for $75, and that is to allow them to process the application and for their fees. Has nothing to do with me at all. What I've been doing as a courtesy to some of my patients is I'll charge the $75 for them through our initial visit, and I'll mail the check directly for them to the Department of Health. It doesn't get there any faster when I mail it versus when you mail it, just so you know that. But it is a way to allow people to, really jumpstart the application process, because the check part, to get that cash and to get the application process, is where the delay is. Most of my patients are averaging 30 days from our initial visit to when they complete the application to when they actually receive their card. So to give you a heads up, it takes about 30 days in the state of Florida to actually get your medical marijuana card. And know that you cannot walk into any dispensary in the state of Florida without your actual medical marijuana card. Another question from Angela. Hi, I'm interested in learning more. I live in Alabama. Is it legal for you to write a prescription for me? Would they mail it to me? Excellent question. Thank you so much for asking that, Angela. We're going to go into that next. One of the things that is important for everyone to know is that 29 states and the Washington, D.C. Division are approved for medical marijuana use at this time. Medical marijuana is not approved federally. Remember, it's a state-by-state regulated entity. So if your specific state has approved for it, then you are allowed to carry it within the confines of that state. Now, there's a lot of little loopholes to this. Point blank being, you cannot travel out of the country with medical marijuana. You cannot travel across state with medical marijuana, whether that's driving or flying. And you cannot travel to a state that does not have it approved. I did a lot of research on law and the concept of it and how would it be addressed if you were to find yourself in a state where it's not approved and you're actually carrying medical marijuana on you. One thing that helps is, just like you carry your driver's license, you want to make sure that you always have your medical marijuana card on you. No, I cannot write you a prescription in Alabama. As I said initially, I am only licensed in the state of Florida. You have to be a Florida resident. A Florida resident with an active driver's license or ID card and a current address. If the address on your license does not match the address on your application, you will not get approved. So just another heads up for all my patients. Make sure that your license is current, because that is the information that the Department of Health needs to process your application as soon and as quick and expeditious as possible. So you would want to check with the state of Alabama, and you can just Google that online to see where they're at in determining if the state will approve for medical marijuana or not. Let me tell you a little bit about what I have found so far. One of the questions that I got is, can I travel on an airplane with legal medical marijuana? Great question, right? Regulations regarding medical marijuana are determined per the state. Patients are not allowed to travel across state lines with medical marijuana, and absolutely not allowed to travel out of the country. According to TSA, the federal government still criminalizes marijuana use in the United States. Any amount for a first-time offender is a federal misdemeanor with penalties ranging from 6 months in jail to a $1,000 fine, or a combination of jail time and a fine. If you're held up in the airport for having medical marijuana on you, it's been the practice of most of the airports and the locations to allow the state to process that particular person or patient. Usually it's not taken to a federal level, but just know that it can be, and it's at the discretion of the state board to determine if they want to, notify the federal agents that you have medical marijuana on you. Usually it is handled in the state. They might ask you to surrender your materials and then allow you on the plane. You just don't know what you're going to get, so just don't take a chance with it, okay? Thank you, my friends, for joining. Natalie, Chris, everybody. Says, Dr. Lynn, do you have to be a resident of Florida to submit an application? Georgia's on the way. Georgia's definitely on the way, Nat, so watch out for that. I know a lot of people are discussing the potential for medical marijuana and also recreational marijuana being approved in the state of Florida. Chris can tell you that the mayor just actually announced and signed off, and you will see it on one of my posts, to decrease the offense of carrying marijuana and also the legal actions that are taken for patients carrying a certain amount of marijuana. So a little bit more to come, and maybe we can discuss that more in our next live post. Let me just make sure I'm answering all the questions. Ellen Lennon over here in Facebook Live. What can I do? What's the next step? Ellen, log on to AskDrLynn.com. All the steps are listed on there. You can email me directly. The next step you need to do is sign up for a free account with eVisit. It is accessible through my site, and then we can get the ball rolling to determine if you're a potential candidate or not. Okay? And Kim, hi Daphne, hi guys. These are my amazing nurses and PAs at Memorial Hospital that I work so closely with and love to death. Thank you guys so much for joining. I hope this wasn't too long, but I hope it allowed you to get some good information. And please, like I said before, I'm always available if you have questions, if there's anything that you need, if you just want to ask, are you a potential candidate, feel free to call me. And again, if I don't answer immediately, remember I have like 5 jobs, but if I don't answer immediately, I'll get back to you within 24 hours with that answer. Okay? Thank you so much. Please remember to like, subscribe, and comment on all of our social media outlets, which include Facebook, Twitter, Instagram, and YouTube. This video will be uploaded to Facebook so you can see it throughout the day, and also to Instagram and YouTube. All right, guys? Have an awesome day, and thank you again so much.